just thinking about the whole picture of a breast cancer journey with, how it can impact your mental and physical health, your relationships with others, your relationship with yourself, and just sort of getting to know a new normal after you've gone through the process. It can be really empowering to have breast reconstruction, or at least know what your options are. My name is Dr. Shannon Colohan. I'm a plastic and reconstructive surgeon. I work for Fred Hutch and UW Medicine, mostly at the Montlake campus, doing largely breast reconstruction, but also a variety of other cancer reconstruction. Growing up, I enjoyed music and the arts, being creative and fixing things. And so when I went through medical school, I came across surgery during rotations as something that was really inspiring because it allowed me to do all of those things in practice, and also to work with oncologic patients. So when I went through training, plastic surgery encompasses a wide variety of things, but I was mostly drawn to the reconstructive aspects of that, and so I pursued additional training in reconstructive microsurgery. So the first thing to know about breast reconstruction is that it's a process. I think most people, when they come into our office, expect and hope to have a one and done type of operation and reconstruction, but oftentimes it's going to take multiple steps. And those steps are going to be dictated by a variety of things, which include your diagnosis, what treatments are needed, so whether chemotherapy or radiation is needed, what your aesthetic goals are as far as your breast size, shape, and desires at the end of the reconstructive process are. And then we're going to take into account for the surgical plan. With the surgical oncologist, we work together quite closely to determine if your plan is for lumpectomy, where they're just removing the tumor, versus a mastectomy, where they're removing the whole breast, because the reconstructive options are going to be different for both of those. For the lumpectomy process, the options are going to include first off, that you might not need our services involved for reconstruction if it's a small enough lumpectomy. Secondary options include breast reductions or lifts at the time of lumpectomy, or rearranging some of your tissues into the area where the tumor is going to be removed to try to restore your normal breast shape. Or if you've had your lumpectomy and you have any asymmetries down the road, we get involved with trying to make things look as even and as natural as possible. For the mastectomy process, that often starts with placement of a tissue expander, which is an empty implant that goes in essentially where the breast tissue was removed and acts as a placeholder for future reconstruction. And then we would see patients back for expansions in clinic to essentially get back their breast shape and size. And then depending on if treatments are needed or not, we time the next stages of reconstruction according to those. And that involves removing the tissue expander and placing either an implant or using your own tissue. We do both at the University of Washington, quite a bit of it actually, as we're a tertiary referral center for this type of surgery. And beyond implants, we do offer tissue options, which can include using transplants of tissue from your tummy, your inner thighs, or your buttock regions, and that often involves microsurgery, which is a more involved process. And then after that, you'll probably have a revision surgery to try to make things look as natural and refined as possible. You might need nipple reconstruction or 3D tattooing, which is then done as a sort of final stage in the reconstructive process. And I guess one other thing to mention is for women at risk of or who have developed lymphedema, which is swelling of their arms. We are also a center for lymphedema excellence, and we provide care for that in the surgical domain as well. So when we meet with a patient, we essentially go through all the options, and those options can include not pursuing any reconstruction. So there's definitely the option to go flat or to not pursue any forms of reconstruction. And then we would also go through all the options around how to reconstruct your lumpectomy or your mastectomy after surgery. I think it's really empowering, and it can be on two levels, or I guess in two time frames. The first is the opportunity to provide an immediate reconstruction. So to give someone at least the beginnings of a reconstruction right at the time of their breast cancer surgery, which allows a woman to feel restored, essentially back to what they were, because the rigors of a breast cancer treatment can be really enduring for people, and so it can give them a sense of wholeness or hope to get back to normal afterwards. The second way that we see people is we often see people who choose not to have reconstruction at the time of their cancer surgeries, and they pursue, for example, mastectomies, chemotherapy, or radiation, and then they come to us after the fact for reconstruction, and we're still able to offer a number of avenues for reconstructing a patient at that stage, which, in my practice could be anywhere from a year after treatment to sometimes 10 years after treatment. So there's not really any burning of bridges that happens by choosing not to do reconstruction, and just know that there are options down the road. And I guess the good thing about it is that there's a Women's Healthcare Act around reconstruction, and so that provides insurance coverage for reconstruction really at any stage with no time or expiration date on it.